Hi, everyone. Sorry, we are a couple minutes late here. Thank you for being on this beautiful Friday update on May 15th. Really, I don't have a whole lot to report, but we do have a new order that will be coming out today. And David, I know it's maybe not up yet, but do you feel comfortable giving a preview of what that will look like so that folks here can at least maybe focus in when the order does come up on some of the areas that have changed? And as you indicated, there are significant changes.
Sure. It changes a lot, and some of the changes are complicated, but I'll try and provide a summary. I think the take-home message is that the goal was to harmonize our order to the greatest extent possible with the state order, at least when it comes to businesses. So at this point, our order with respect to businesses is less about the which and more about the how they can do things. So what does that mean? Retail of the state has opened up a lot more retail that can be available by pickup. So the stores themselves can't open to the public. People can't go inside. But folks can order and pick up goods. And we're talking about bookstores, jewelry stores, toy stores, clothing and shoe stores, home and furnishing stores, sporting goods stores, florists. In addition, services that can be provided consistent with both social distancing and face masks are not now allowed. So we're talking about things like pet grooming, dog walking, car washes, which were already allowed under our order, appliance repair, residential cleaning, janitorial cleaning. Again, that ties directly to what the state did on I think it's the 12th, which feels like a couple weeks ago, but now I guess it's only a few days ago. In addition, office buildings can open. That's not really as big a deal, I think, as it might seem on its face, because our order still requires people who can be assigned to work from home. But the office buildings themselves can now be open, even if they don't relate to an essential business. Outdoor museums, again, that's a state category, obviously not a huge category, but we do have we have a couple of outdoor museums that might benefit from that. And then anything that the state has previously deemed essential that might not have been captured by our order, we don't think there's much. The thing that jumps out to me would be car dealership showrooms could open because they're opened under the state order as an essential business. The order also loosens to some extent activities, specifically outdoor recreational facilities that previously had to be closed now can be opened if they are actively managed and monitored. They have to be actively managed and monitored. They can't just be opened. I think the example that probably is most significant for people would be pools. Both indoor and outdoor pools, actually. Otherwise, outdoor recreational facilities. We've also removed the 10-mile limitation. Under the prior two orders, there was a limitation as to how far you could travel for the purposes of recreation. We have removed those, but out of a desire to continue to protect the coastal areas from crowds, we do have a limitation that prevents people from traveling by vehicle to the beach coastal areas and trails between the hours of 11 and 5 p.m. If you want to go to the beach between 11 and 5 and you can get there with people power, you can. But if you want to drive to the beach, it has to be before 11 a.m. Or after 5. Those are sort of a high-level summary of the changes. They're more complicated than that. Oh, also childcare. Previously, childcare had been limited to essential workers. Childcare and related programs are now open to all workers, and we're providing more guidance as to what we mean by a stable group. Specifically, the groups need to be together for at least 4 weeks, and children and staff can't be with multiple groups at the same time.
Great, thank you, David, and thanks again. I know the amount of time you have put into this has just been tremendous, tremendous. So thank you for all your work. Just a couple other updates. As you can see, we're at 1575 cases. That's a plus 39 since yesterday, a plus 50, 60 from the Wednesday session. So you can see we still have jumps in cases here that are pretty dramatic. And again, testing is not fully rolled out yet. We do hope to increase testing, and we'll be working on that. We've additionally had one more death since we've last reported, and that's 66 now, sorry. Those hospitalized are at 69. We've crossed over 20,000 tested, so we're at 20,684 tested. The average days to results, I think, creeped up just a little bit, and we'll see probably that creep back up as more testing gets ramped up in the county, and that's just a matter of throughput. At the event center, we've got 7 guests. At Burlingame facility, we've got 9 guests. That has creeped up a little bit, and our plan would be to keep that in place at least through the summer here to determine if there is a further surge, and we want to make sure that we have appropriate rooms available. And we'll look to make that more potentially of a regional asset as we talk to our partners in surrounding counties. The Bayfront Station, we have 85 guests, so we have 11 rooms available. And various other hotels, we've got 86 guests. So total in hotels in the county, we have 171 guests. Just the only other thing I have really is a quick update, just to reiterate what we're doing next week in regard to testing. We will have the event center testing still up and running Monday and Tuesday. We're hoping to get at least 500 through there. So we need to really kind of advertise that as much as possible. And we will be getting that advertisement out. And then on Wednesday, Thursday, we will be in Daly City, and Friday, Saturday in East Palo Alto. And at those locations, there will be walk-up capability. We're hoping that people will register online, but there will be walk-up capability. There will be people there to assist. For those who can't navigate the system online, we'll have laptops there, and we'll be readily able to help folks in different languages with different language skills make sure that they get registered. And again, our goal is to make sure that we reach every corner of the county, and we continue to outreach and try to get as many tested who feel that they need tested or want to be tested. So with that, like I said, don't have much today, but why don't we go ahead and see if there's any questions about the order while we got David on the line, or any other questions?
Looks like we have one hand raised. John Mays, I'm going to go ahead and unmute you. Could you let us know where you're calling in from?
Hi, I'm calling in from the San Mateo Daily Journal.
Great.
Hey, John, how are you?
Good, how are you?
Good, thanks.
Good. Not that anyone's going to be complaining. Maybe some people will complain, but the order seems to be kind of a dramatic shift. What's the rationale, and what conditions have changed to allow for this order to be coming out later today?
Well, I'll take a stab at it, and then David, maybe you can jump in. But you know, I think it's certainly that Dr. Morrow has indicated that we're moving in compliance with the state. This is the floor of the state. I think he's always tried to get to that level where we were coordinated with the state, and we are now there. The numbers have somewhat stabilized. We don't see dramatic spikes in the numbers. We've got kind of a steady flow of numbers that we can handle with the hospital beds and PPE and things that we have in place now. So I think that that's played a major part of it. I think it's also an opportunity to do away with some of the confusion, and not that, certainly that this doesn't come into play, but a byproduct of this is obviously we're opening up more of the economy, getting people back to work. And we feel that we can certainly ramp up some of the testing here to make sure that we continue to monitor the community to see if we see a change in the illness, or the illness starting to take hold. But, you know, I think Dr. Morrow has also indicated that, you know, at some point we've got to start to reopen, and along the way, more people will get sick. We know that, but we do have the facilities in place now, and this is probably the time to do it. So
Okay.
David, I don't know if you have more to add to that.
No, that's well said, Mike.
Just as a follow, you know, you covered the hospitalizations and the deaths. Testing seems to be ramping up, especially with the mobile testing next week. One factor is the tracing. And I'm wondering where the county is on that, how many contact tracers there are available, what the overall goal is, and sort of how soon until the county meets that goal.
Yeah, so we're in good shape on the contact tracers right now. We have excess capacity. I believe we have 40 or 45 right now. 40. We have 40 right now in place. They have capacity. We are looking to ramp that up to 150. That should be more than we need. So we're in the process of identifying those individuals now within the county structure that will really work as kind of a reserve corps more than anything else, like the National Guard. We'll call them up, we'll train them, and then we'll call them up as necessary, and they'll leave their job that they're assigned to. It could be librarians, it could be attorneys, it could be public works folks, it could be really from anywhere in the county and everywhere in the county that we pull from to get these folks trained up. But 150 will give us, I mean, I think that the state really mandates we have 115, thank you, Peter. But we want, everything we do, we want to build in capacity. We want to make sure we're on the outer edge and over that for worst case scenario. So we're going to build it to at least 150, and we can scale that pretty quick.
Great.
Okay. One more, I think this might be for David. You mentioned it's not so much which businesses, it's how. Are there businesses that are going to be unable to open, and what's the forecast for them?
Well, I mean, I think the simplest answer to that is if they're open, if the state has allowed them to open, they can open. They just have to comply with a social distancing protocol, which is something that we've required of all businesses for quite some time. And then in addition, the state has issued detailed guidance for each industry that it's opened. And we have incorporated that those guidelines by reference and made them a requirement. You have to comply with the industry guidance that the state puts out. So my hope is that any business that's eligible to open can comply with that guidance. I mean, it's industry guidance. I mean, if you're asking me, I mean, there are lots of businesses that are not allowed to open still, but the reason they're not allowed to open is because the state isn't permitting them to open. And we're talking about bars, table service at restaurants, movie theaters. I mean, there's a lot of examples, and most of them you could probably predict because they result in gatherings of large groups of people who can't maintain social distance.
And John, just to follow up on that a little bit more, we will still require, and it will be required for us for social distancing and face coverings when out in public interacting with these businesses. But really now we're effectively at the floor of the state, and they have put in prerequisites for us to move to a full phase 2, and we're not anywhere near meeting those prerequisites. I think we indicated last week it was 77 illnesses and new cases in 14 days. And as you can see, we've had 60 in the last 2 days. So we're nowhere near that, and 0 deaths over 14 days. And we just had one since Tuesday. So unless the state moves on that or loosens that or moves again, we're here, but we'll be looking to the state for the next steps.
Great. Next question is from Henrietta Burrows. You've been unmuted.
Thank you. Given the high death rate of seniors who live in assisted living facilities and nursing homes. And the fact that many of the employees working with them work 2 and 3 jobs and come from vulnerable communities. Has there been mandatory testing of the employees working in assisted living facilities?
Well, we've got, and Peter, I'll let you follow up, but we've got our folks in these facilities. In fact, Peter and I were just talking before we went live here. I think they've accomplished an incredible amount, going to 219 of these facilities so far. And I think that was, I mean, you might have asked the question last time, or maybe it was Emily. Yeah, it was Emily.
No, I did. I'm just following up on my question from last week.
Yeah, so so they've been out to 219 of these places, and they offer the test up. They look at the operations. They offer guidance, but this is one of those areas that we're going to have to continue surveillance, and it's just not one time through. This is so important, and your point's well taken that these people are these folks are very vulnerable, and that's going to mandate really kind of ongoing testing once we get through here. So there is no order in place that I'm aware of. Peter, maybe, or David, maybe but certainly it's a good practice, and we'll continue to be out there putting efforts into that. Again, this is not our obligation; it's a state obligation, but we are responding because obviously these folks are in our county and we care about it.
And Dr. Morrow would like to have the facilities all tested, but again, it's a state regulated, licensed facility, and they're all private entities and enterprises, so the county can't necessarily tell them they absolutely need to do this or that. But we definitely are doing everything we can to support them and help them get through this difficult time.
David, any thoughts?
So we do have an order that is specific to congregate care facilities. It's one of the orders I didn't work on. I did pull it up while we're here and did a search for testing. And it does provide for some mandatory testing in certain circumstances. For example, it provides that if a facility learns that any facility resident or facility staff living or working at the facility, or who has been receiving, living, or working at the facility has tested positive for COVID-19, the facility must immediately notify the communicable disease unit, and then facility residents and facility staff are subject to mandatory testing. So it does touch on that issue, and it has a lot of other requirements and limitations in it. It's available on the health website, and Ms. Burrows can take a look at it, and if she has any questions about it, I can try and get them answered.
Thank you so much.
Thank you for that clarification, David. Really appreciate it.
Great.
Any other questions?
Yeah, looks like next hand raised is from John Mays. You've been unmuted.
I just one more, or actually I have two more. So because there was some confusion maybe last week about the difference between the state standards and the local standards, is the goal now, is it fair to say that the goal now is to sort of align the county's guidelines to the states unless something else happens that would cause them to shift?
David, David, you want to take that?
Yeah, I mean, I think that, I mean, you phrased it really, really well. Yes, I mean, the intention today is to align with the state, and that's what the new order does. It aligns with the state. But as you observed, conditions change, and conditions can be different in different places throughout the state. So we're going to have to continue to monitor and make decisions going forward. But as a general matter, we made a decision that, at least as of today, that the right choice for us is to align with the state.
Got it. And then the last question, how long are the beds going to be at the event center? You mentioned the Burlingame one, but not the event center. Is that through the summer as well?
Well, yeah, we're going to have John, we're going to have the capability there. Now we have I believe, stored those beds, and they're stored at the event center. So they're not up and out anymore, but we're keeping the capability there through the summer at least, because we want to make sure that we always over prepare any type of event here related to this, because it's just so unpredictable. So we're gonna maintain that there.
Okay, thanks.
Next question is from Emily Miebach. You've been unmuted.
Hey guys. So 2 questions. I think the first one will probably be for David. Curious what the changes to the court system will be, if any. I know it's a little different given the
Yeah,
Supreme Court.
yeah, Emily, I don't know. David, do you know?
So our order does not is not expressly directed to the courts. They would be considered governmental operations under our order and would be able to make choices for themselves. My anecdotal understanding, which is probably not good enough for a news story, is that the changes that are happening in the courts are happening in coordination with the Judicial Council and the presiding judge of the Superior Court. We're following, my office is following what's happening with the courts very closely, and the courts have not signaled in a public way that changes are coming at the moment.
Then my other question is probably more for Mike, and why make the decision to store the beds at the event center?
Just so they're readily available if we need them, and that it's a great form to large form that we can roll them back out and set them up again. It's really for convenience more than anything else.
I meant more why decide to
Why does that? So it could be used for other things in the event that it is. I think it's actually being used for storage right now.
Yeah. So maybe Emily's question is, why aren't we setting them up in case? Because we have tremendous surge capacity in the hospitals. There's no need to set the beds up.
Yeah. So
Okay.
I think
Thanks, Peter.
Yeah, that's exactly right. Exactly right. And it allows us to utilize the facility for other things. But at least we have the beds there, and we're able to reset them up if necessary.
Thank you.
John Mays, you've been unmuted.
Thanks. What time's the order coming out?
It's coming out this afternoon, so it's a couple hours.
Yeah, I mean it's gonna be soon. It's not up yet, but it's done, and it's just being processed. So I would anticipate sometime in the next hour.
Okay, thanks.
Yeah, and like David said, there'll be significant changes. Okay, so no other questions? All right, so I do have one thing to add, and that is on the call with the other folks, we took a poll whether to stick with 3 days or go down to 2 days, and it was overwhelmingly in support. They were overwhelmingly in support of going down to 2 days, mostly because Mondays there's not really much that transpires over the weekend that really allows us to report out things. So if it's okay with all of you, we will go down to 2 days, Wednesdays and Fridays. We'll try to certainly get you more information during those time periods. But that is our thinking right now. So you're all going to get a half hour of your lives back here very, very quickly, starting Monday. So our next time we will see all of you, or at least be online, will be Wednesday next week. Okay, everyone have a great weekend. Stay safe out there, and we will see you next Wednesday. Take care.
And yes, it will be the same time and same Zoom number. I just saw that pop up.
Same time, same Zoom number, same room. All right.